Hey guys, thanks for joining us tonight. I am so happy and grateful that you were able to take the time away from your busy schedules to join us and get all your questions answered about this really, really important topic. And I am really happy that Lisa Syed is here from Thermography Rochester, and I'm going to turn it over to her so she can introduce herself and let you know a little bit about why she does what she does. Thanks, Lisa.
Well, thank you. Well, hello, everybody. I will give you a little introduction to myself. My name is Lisa Syed, and I'm the owner of Thermography Rochester. I come to thermography through a background in adult education and technical communications. And my personal story is that when I was young, below 30, around 27, 28, I accidentally found a lump in my breast. I was a student teacher coming off a teaching round and was not looking for lumps, accidentally found it. And it was a very scary time. I found it on a Saturday morning and really had to wait through Monday before I could see a doctor and see what was up. In my case, I wasn't given a mammogram because I was very young and had 2 ultrasounds, which were equivocal, and the doctor decided to do a lumpectomy. So I did have a right breast lumpectomy, and which turned out to be benign. But because I was so young to have a lump, and I think from what my doctor told me at the time, his best advice to me was, you need to start getting mammograms now because you're at a higher risk for getting breast cancer. And I ran for those mammograms because I believed they would save my life. I haven't had any serious breast issues ever since then. But when I heard about thermography back in the early 1990s, my interest was piqued because I'd gone through this in my own life, but my background in teaching was like, well, I can't become a thermographer. I'm a teacher, but I've always sort of thought, well, if I go back to school, I would like to pursue thermography, and so I had that opportunity. And back in 2011, I completed my certification, formed my business, and started doing thermography. And so my mission really is saving women's lives through early breast cancer detection. And I think education is a big part of that. Thermography provides that piece of the puzzle that helps you make the decision, what should you do next, or evaluates if you're doing the right thing in your life as far as lifestyle and diet and wellness. So with that, I will move on to thermography. So what is thermography? It's an imaging procedure. It uses thermal imaging to measure the heat generated by different parts of the body. That's a high-level definition. And it has many uses in the industrial settings and scientific other settings, sports settings, even in racing settings with horses. But in my case, I use thermography mostly for breast cancer risk assessment, to provide adjunctive or extra diagnostic information, to monitor treatments, and as a prognostic indicator. And a prognostic indicator is what's coming in the future if I don't make any changes now. What's a likely outcome in the future? And thermography has been FDA approved since 1982 as an adjunct to mammography. So it's not, first of all, it's not a new technology. People sometimes think it is, but it's been around since the late 1950s. FDA approved since 1982, and not an adjunct to mammography. What that means is it's not a standalone tool. It works, it's one of the tools in our toolbox that we can use, and it works together along with mammography and the other tools we have for monitoring breast health. Ultrasound, a doctor's physical, self-checkup, MRI, biopsy, mammograms, all of those fit in as tools in our toolbox. And it has many applications, some of them outside of the medical world, but in the medical world, these are some of the things that thermography is used for. And you'll see if you look at the list, it looks at soft tissue injuries. It can pick up in dental issues, infection below the gum line, helps to visualize pain, sports injuries, that thyroid function, that sort of thing. But as I say, mostly what I do is breast imaging, and I'm starting to do a lot more dental imaging these days. we'll talk about that down the road if we have time. So here's a picture of a thermogram. And a thermography measures the heat generated by the microcirculation of blood in the breasts, regardless of the cause. And so you'll notice here that it's looking at heat. It's not looking at lumps. And as such, thermography is called a functional test because it looks at how the blood flow takes place in the breasts, where an ultrasound, a mammogram, an X-ray, an MRI, those are all structural tests, and they're looking inside the breast at structures that are there. And how a cancerous cell grows, and really what thermography is looking for. It's looking for vascular changes. And the premise behind thermography is that before abnormal cells can grow, they need a blood supply to feed them. And that's what thermography is picking up at this earliest stage. You'll see in this slide here, initially cancer cells form, and your body's way of dealing with cancer cells, and it does that all the time, is to fully encapsulate them with other cells, to cut them off from a blood supply. And eventually those cells starve and die, and our body deals with cancers all the time this way. And they may stay like this in the body throughout one's life. They don't change, they don't grow. And the million-dollar question really is, why do some of these, and this is called DCIS, ductal carcinoma in situ, why do some lumps grow and become full-blown breast cancer and others don't? And that is a good question. But what thermography is looking for is that earliest change or stage of change where your blood vessels will start to grow to support the growth of cancer cells. And as I say, for me, that's very interesting because thermography will pick up that second stage in this chart here, the middle picture, where the vessels are starting to grow. The lump isn't large enough to be seen on a mammogram yet in any case, and it will be many years before it is large enough to be seen. And earliest detection, we tend to think of mammograms as being the earliest way to find lumps. And certainly if we were relying solely on manual detection, an X-ray mammogram can pick up a lump sooner than that. But you'll see that thermography will show heat, and the term for that is angiogenesis, or the growth of new blood vessels, at sort of the 2-year mark. At the 2-year mark, something that's growing is about the size of the head of a pin. And at that point, it no longer can rely on the surrounding blood supply for fuel for growth. And so that is the point where the body will start to supply its own blood cells to support the cancer cells. And so at the 2-year mark is where you might start to see indications that there's something changing. Now, if you were to run off at that time and get a mammogram won't find a lump that soon. And so your mammogram might come back negative. And so it's a whole discussion that hopefully we'll have about false positives, false negatives. Thermography is just picking up vascular changes at a very early stage, and it's something to pay attention to. It's also something that we have in our power to change our outcome through diet and lifestyle choices. And you probably are aware that there's significant research to say that cancers, to a large extent, can be prevented. Once they're there, it's much harder to deal with them because they've been there for a long time through natural means. But before they even begin, we can take a proactive, preventive approach. And as you'll see here, most tumors are 6 to 8 years old before they're discovered with a mammogram. I think this slide for me was very compelling and why I chose to follow up with thermography. This slide shows that active cancer cells double in number every 90 days or every 3 months. And of course, we have faster growing cancers that will grow faster, and we have slower growing cancers that take us a longer time to grow. But as an average, every 3 months, the number of cancer cells double. Now, no means is going to find a 2 mass cancer cell, 100 mass cancer cell. They're too small. But at the 2-year mark, there will be the beginnings of a new blood supply to support the growth of these cells. If we're going to be developing them, they'll develop into cancer. And this is the earliest stage where you'll start to see vascular changes. But a mammogram won't pick those changes up until the mass is large enough to be seen through the skin on the surface of the mammogram machine after you've had radiation shone through you, and we'll look at that too. But most tumors are 6 to 8 years old before they're discovered with a mammogram. So if you have a mammogram and it comes back negative, and that's really all the information you get from a mammogram, no, we don't see anything, come back next year, you're fine. But are you really? Is something going on behind the scenes that we're not aware of yet? Thermography gives you that picture. So people ask me all the time, what's the difference between a mammogram and a thermogram? And so here's this slide, kind of talks to those a little bit. A mammogram, as you know, uses X-rays to produce an image that's a shadow of dense structures. Suspicious areas need to be large enough and dense enough to be seen by radiologists. Thermography, on the other hand, is a completely different technology, and it uses infrared sensors to detect heat from increased vascularity, or angiogenesis, that's emitted from the body. The heat is compiled for an image into an image for analysis by trained medical professionals. And so personally, my training is as a technician. I'm not the person who's trained to read the images. My training is to take the images. And I work with a doctor in Toronto, Dr. Alexander Mostovoy, who's Canada's leading thermographer. And I'm very happy to work with his office. And he's been doing thermography since the early 90s. Structural imaging. A mammogram is a structural imaging tool, where thermography is a functional imaging tool. A structural image looks for structures. It can locate the area of suspicious tissues, but it's invasive. Anything that looks below the skin is using some invasive means, whether it's mammograms and x-rays, or ultrasound, MRI, the dyes and whatever. There is some level of invasiveness. Thermography is a functional test, and as such, it's non-invasive. It looks at how something works, so it detects physiologic changes or how something works. And an example of a functional test, if you need to have an example, is blood pressure, where you have the two readings, and they really look at how the blood is working in the body. And another one is a heart stress test. Perhaps people have had one where the heart is, you're hooked up to equipment and your heart is measured at rest. And then you wear the equipment or you put on a bicycle and do something strenuous, and they look at how the heart functions under stress and compare those things. So thermography fits into that group of testing. It doesn't locate the exact area of suspicion inside the breast because it's non-invasive, and it's only picking up heat that it emits from the surface of the skin. Mammograms can detect tumors in the pre-invasive stage, but they cannot diagnose cancer. And I think people seem to forget that and think, oh, I need a mammogram to find cancer. Actually, a mammogram finds lumps, and then you need to switch to another tool, ultimately a biopsy, to see if something is cancerous or not. A thermogram can show you the first signals that a problem is happening, but it also cannot diagnose cancer. It diagnoses heat, the same way a mammogram finds lumps. At the end of the day, only a biopsy can diagnose cancer, and once you determine that there's an area that's suspicious. And I don't know if anybody out here, usually when I talk to a room full of people, I can sort of look around the crowd and see who's had a mammogram and who hasn't. And often even people who've had mammograms don't exactly know what's going on when they have one. But when you get a mammogram, there's always some degree of radiation. And it's questionable as to enough radiation, how much radiation, prolonged radiation, low levels of ionizing radiation. But it's known that low levels of ionizing radiation, such as what's given out when you get a mammogram, can be harmful to the breasts and can actually increase cancers. And there are many forms of cancer. And so some cancers are not as sensitive to radiation as others. Of course, we don't know that ahead of time. So reducing your exposure to radiation is what thermography is really important for. If you've had a mammogram, you'll see that, as the image shows, the one breast is placed on a plate. There's a film below that, the breast is compressed as much as possible so that you don't have to use as much radiation, but radiation is shone through the breast, and any dense structures are picked up as shadows on the plate below the breast. And those show up as white areas because they're shadows. By comparison, here is a picture of my office, and people who've actually come to my office are surprised that the camera is really, really little. The photographer just had nothing much to shoot, so she made the camera look very big, but it's a small camera. The person sits on a stool as close, and I move the camera as close as I can to the person. I'm not interested in wasting my 78,000 pixels on the wall behind the person, but we capture the person, if we're doing breast imaging, from just below the chin to just below the breasts. The person places their hands over their head, and I capture several different images from the straight on, but also from a profile view, a 3/4 view, and I get an underneath view to the best that I can as well. And at the end of the day, you really are trying to reduce your exposure to radiation. So again, in a room full of people, I'll usually put it out there like, so how much radiation is okay for us to have? And the answer to that, and not everybody gets it, but the ideal answer is none. No radiation is good for us. And yet we're surrounded by it all the time. We can't get away from the fact that the sun gives off radiation. Materials there that are decomposing over the millions of it give off radiation. We're surrounded by it all the time, more and more in our technological age. So this chart here just shows some levels of radiation that people are exposed to, what the effects are from various things, dental x-rays, a plane ride, a mammogram, a chest CT. And what they're looking at, the millisieverts, is rather than looking at what the equipment is putting out as far as rads of radiation, because they'll tell you how many rads of radiation equipment puts out, but it's really important to think of, well, how does my body receive that radiation? And different parts of the body receive different radiation differently. It affects different parts of the body differently. So for example, bones are less sensitive to radiation than breast tissue is. Breast tissue is quite sensitive. The reason for that is as the cells replace themselves, once there's a mutation from radiation in a cell, that replicates itself more frequently because the breast cells replicate more frequently as a cycle than, say, tissue, bones, organs, etc. But anyway, that's about radiation and minimizing one's exposure to it as much as one can. Another interesting area about thermography and mammography is what your mammogram can miss. And anybody who's had the experience of having a mammogram knows that they really try to squish that upper portion of the breast into the machine, because that is breast tissue. We don't tend to think of that part being breast tissue, but as you can see in this slide in the bottom corner, the breast tissue is sort of a teardrop shape that extends up to the shoulder. And it's not just the nipple periareolar area, it's up higher than that. And the upper outer quadrant of the breast is where you'll find 50% of breast cancers. And 50%, you can see the other quadrants and the nipple area don't have that higher number of breast cancers. And yet the upper portions of the breast don't fit in the machine. As much as they try to, it always pops out. And so thermography is excellent because it captures the whole breast from the chin down, under the arms, the axilla, the lymph nodes, and gives you a good starting picture. So I think that's probably enough to give you a background about a little bit what thermography is. The next bit of my talk is a little bit about, so what do we do with those pictures? And one of the things that I like about the office I work for is they uphold internationally accepted standards. And some of the earlier criticisms of thermography were correct in that at the time there were no standards in place, and one person might do thermography one way, another person would do it a different way. Maybe the room might be warmer, colder. Sometimes people would use fans to cool down the breasts. Other places didn't. And so there are guidelines, internationally accepted guidelines, that ideally all thermographers should follow. Sadly, not all do, but it's important that we do, because in order for thermography to be accepted in the medical world as a science, or to be accepted anywhere as a science, it has to be repeatable. And if I can't repeat that, then I'm really not doing thermography a favor. I'm certainly not doing you a favor if what I've done in my office isn't repeatable in someone else's office. So there is an International Academy of Clinical Thermology. I follow those guidelines. And one of those things is doing something called the cold challenge or cold stress test. And if anyone out there is in the health world listening to this, you would know that in a functional test, you need 2 sets of data points to complete your report or your analysis. So again, blood pressure has those 2 readings, one over the other. Heart stress test is like that. If you were looking in the material world and you're looking at how strong is a bridge, you would measure it with no load, and then you would load it and see where fracture stress points take place, and then make changes to your design as needed. And so similarly, for a functional test, I need 2 sets of data points. And so one of the ways I get my second set is I'll take the first set of images after you cool to a cool but non-shivering room temperature. And I take my first set of pictures then, and then I'll have you place your hands into a bowl of cold water, very specifically a bowl of 50-degree Fahrenheit cold water, for 1 minute, wait for 3 minutes, and image your breasts again. And what we're looking for there is your body's expected response as a result of the cold water is that your vessels will constrict. And what the doctor will look for, well, he will compare the left breast to the right breast, and we'll talk a bit about symmetry in breasts, but he'll also look at the right breast before the cold challenge and the right breast after the cold challenge. He'll look at all the areas that show up as warm areas and see, did they cool down the way we expect them to? And not all cancers, but some cancers have nitric oxide in the vessels that feed them in order to keep the blood vessels dilated so that they can pump more blood to the cancer cells. And so the cold stress test is a way that we can determine that something is not behaving the way we would expect it to. I might have a person might ask a question, oh, but I have Raynaud's syndrome. I can't put my hands in cold water. And that is true. You can't put your hands in cold water if you have Raynaud's syndrome. So I do have a different protocol that I follow in those cases. So I always check ahead of time if a person is able to do the cold challenge. And if not, I follow a different protocol. And so what do you get from your report? Thermographic pictures are taken, analyzed, and rated to determine risk for developing breast cancer based on international standards, which I've touched on a little bit. And everyone's always curious, like, well, what does a good one look like? What does a bad one look like? So here are a couple of images. What you get from your report are 2 pieces of information. You get where does each breast fall in this category of risk, from TH1, lowest risk, to a category of 5, highest risk. That's called, those TH levels are thermal stages. They're not cancer stages, they're just thermal categories. You can see there are 2 low risk categories. There's a medium risk category, and there's a high risk category. An example of a lowest risk category is you'll see very clearly that sort of teardrop shape of the breasts because it's fatty tissue, large breasted or small, and the fatty tissue should be cool, ideally. They should be symmetrical. This is the ideal. Not everybody is the ideal, but that is the ideal. And different people fall in as they're normal in different places along this continuum. The highest risk, though, you can see is a lot of asymmetry between the 2 breasts as far as heat emissions go. And the warmer breast is the one most at risk of having cancer or developing cancer. So that's the one piece of information you get. The other piece of information you get is a numeric score, a discrete point, so that I know where do I fall in each one of these categories that you see. And they're written below 0 to 29, 30 to 74, 75 to 119, and so forth. And what I do over time for women is chart those scores so that you can see how your breast health is trending. And that's really important because unlike the mammogram that, gosh, it was fine and now suddenly it's not. Thermography gives you a chance to see for years ahead of time, like, what's going on with my breasts? Are they healthy? Is my breast health healthy? Can I change it? Are the changes that I'm implementing in my diet and lifestyle having a positive influence on my breast health? All of that's very visible, and you can change things to make it work for you, is the idea behind it. Let's see here. And you can see here in the images here, again, examples of the low risks. You can see basically they are very symmetrical. This Th2 is typically somebody who might have cystic breasts, fibrocystic breasts, dense breasts. These are all things that are difficult for mammograms because mammograms look for structures. But cysts, fibrocysts, and dense tissue are not high risks for breast cancer. They're worrisome for the person who relies on mammograms. And you need to then follow up and see that, oh, it's just a cyst. But there is no blood flow associated with these issues, and so they're not high risk for developing breast cancer. And so for that person, and there's a lot of people that fall in that category, I think thermography gives you peace of mind in addition to the other information you can have. And you can see here the Th3, the medium level, is considered equivocal or middle of the road, not too sure what's going on here. We'd like to follow that a little more closely, but you'll see here there's a distinction between the left side and the right side. And it's the warmer side. And in this case, in each case, it's the left breast of the woman, but that's warmer. But, and the Th4 and the Th5, you can see again, if I were to look at the breast side, they wouldn't look different. These are heat pictures. And so with that information, what can you do with it? There are several things you can do with it. There's a recommended follow-up, and you could just like, oh, they want to see me next year, I'll come next year. Or they want to see me in 6 months, I'll go in 6 months. But you could do so much more if you want to. One of the things that thermography will point out is hormonal imbalance. And we're all women, and we're all going through stages of life. There is a good likelihood that at some point in our lives, we will have hormonal imbalance. That's part of being a woman. But having optimal hormone levels or optimum balance lowers your risk for getting breast cancer. And if you think about all the women who develop breast cancer that we know, gosh, so many are in their 40s, 50s, 60s. And when you think about breast cancer taking about 8 to 10 years to be found, you'll sort of see that those hormonal years are when things can be growing. So here's an example using thermography of a before and after. And so in this case, the doctor, her scores were, I think, a medium risk. One was a low risk, the one breast. The other one came back as a medium risk, if I remember correctly. And what this person did was upped her levels of cruciferous green vegetables. Indole 3-carbinol is a supplement that is made out of cruciferous green vegetables. One thing a hormonal imbalance in a thermography report doesn't tell you is what exactly is the imbalance. And that's really where you can work with someone who's a coach, a nutritional coach, or someone who works with hormone balancing to find out specifically what it is for you. But there are some good guesses that one can make. Typically, the hormonal imbalance is too much estrogen. And so if that's the case, as it typically is, a supplement like Indole 3-carbinol is helpful because it helps you break estrogens. Those green, cruciferous green vegetables help to break estrogens down into components, 3 components that are more easily flushed from the body. And again, if you're thinking about flushing things from the body, you should be upping your water. So that's something I counsel people about too. Generally, we don't drink enough water, but that's a whole different topic. This person also increased her levels of vitamin D. And vitamin D is so important to everybody's health, men and women alone. And in our latitude, most of us are vitamin D deficient. We either don't get out enough, or if we do, there's just a little bit of our face that shows on a snowy day. You need a good 15 minutes of sun exposure to get enough vitamin D from the sun. Most of us don't get that. And so supplementing is how we can do that. Again, if you work with someone, not everybody absorbs vitamin D easily. So you often need to combine it with K2. A blood test will help you know if your body is actually absorbing what you're taking. And this person also took evening primrose, and she used essential oils, specifically frankincense and lemon, which are known to be beneficial to breast health as well as other areas, and did yoga. And yoga is to get the lymphatics moving. That's one of the things, just helps to get things going through the body. You don't need to do strenuous exercise, but anything that gets the body moving, so yoga, walking, rebounding, swimming, those are all good examples of the type of exercise. And you can see that a year later, her breasts are much improved. This was done in 2011, 2012. This particular person I saw about 6 months ago, and she looks exactly the same today as she did in 2012. So she's maintained this balance. Her levels came down to low risk levels from a medium risk levels. And so thermography is a very good way to see that, oh, it's working for her and she's maintaining it. I also mentioned earlier that I chart people's progress or breast health on charts over time. And here's an example of not the same person, a different one, but someone who I always ask people when I see their scores go down, what did you do to change that? Because 9 times out of 10 people have done something. And this particular person says that all she used was Young Living oils. But you can see here, if there's a hormonal imbalance, it doesn't affect one breast, it affects the whole body. Breast cancer affects one breast. We don't ever get cancers growing in identical locations at the very same time. So again, this is a very typical for hormonal imbalance, and you will see that the hormone numbers will swing up and they'll swing down. And as long as you stay within the low risk, ideally level, that's the goal. And if you have higher numbers, you want to bring them down. I'm included this. This is somebody who made diet and lifestyle changes after going through a health crisis with Lyme disease and parasites. Probably some of the medications she took to deal with those things put her body into further stress, including early onset menopause in her case. But you can see that, and this is my most dramatic case of someone who's made diet and lifestyle changes, that her numbers have gone down dramatically between 2013 and 2015 through diet and lifestyle. I haven't updated it, but she's actually also maintained these lower scores over time. And I include this because it helps tell the backstory of this slide, where this is somebody who's developed breast cancer. And in this particular client, when I first met her, her scores came in for both breasts at a 75, which is on the sort of edge of low risk and medium risk. She did have a family history of breast cancer. And so a medium risk, typically the follow-up is 6 to 9 months. And so I was seeing her every 9 months. The next time I saw her, one breast stayed the same, one breast increased. And that concerned her a lot, enough that she did jump on board and make significant diet and lifestyle changes to her diet. And in 2015, you can see that both the scores went down. But that one there is still on the cusp of the Th2, Th3, so the follow-up was 9 months. And 9 months later, when I saw her, one breast score had gone down again dramatically, and that's really very much like this previous lifestyle. And I know that the person is following a healthy diet and healthy lifestyle. But despite that, the other score went up very high. And in this case, she did have breast cancer. She followed up with an MRI. She followed up first with an ultrasound, which came back negative. And she just decided that she wanted an MRI. She paid for it out of pocket because it wasn't recommended for her. And they found three areas of breast cancer in the one breast. And she had actually opted for a double mastectomy because it was an aggressive form of cancer. So she opted for the double mastectomy. But it was found at such an early stage that it had not metastasized. And so she didn't need chemotherapy or radiation. So she was very thankful that thermography gave her those first indications of a problem and led her to take the steps that she took. So kind of getting back to the differences, because people always ask mammograms, thermograms. Does thermography replace a mammogram? That's a question I'm asked all the time. And certainly the FDA says those two should go together. And they both look at different things. And so again, just sort of very generally, a mammogram, it's a structural test. Thermogram is a functional test. One uses x-rays, one uses infrared. One detects lumps, the other measures heat or inflammation. One uses compression, and there's some evidence too that compression, certainly for about 50% of the people who get mammograms find that they're painful. I get some people though who find that they're more than painful. They have lingering pain for 5-6 weeks later. They've had bruising. I had one person tell me that she had some bleeding because some skin tags. And if you think about it, and to say nothing of people who have implants, we won't even go there, but people worry about, what if I squish something? And there's something to be said about that. When you get a mammogram, it's about, I was told that you need between 20 and 25 pounds of pressure per square inch to squish the breast tissue flat enough so that you use as little radiation as possible to get those images. And that's a lot of pressure on the breasts. And so there is some indication that that in itself is not good. And if you think if there's bruising, all cancer cells are looking for is a blood supply. If you're going to squish your breasts to the point that you bruise them, you're providing that blood supply, whether or not it's picked up upon. Radiation, no radiation. Not recommended. Mammograms aren't recommended for pregnant women. Thermography is safe for pregnant women and young women. However, if you're a pregnant woman, we don't really recommend it then, not because it's not safe for you, but because the hormones in the breasts are so elevated during a pregnancy and during nursing that we usually will ask you, if you need one, we'll do one, but you really will get a better, truer picture of breast health after those periods of pregnancy and nursing are behind you. Mammograms have difficulties reading large, dense, and fibrocystic breasts because of the dense tissue. Thermography is excellent in reading those because we're not looking at those things, we're looking at something else. And the last part on this slide, which I find interesting, is a mammogram averages 60% sensitivity in women under age 50 and 80% sensitivity in women over age 50. So what that means is that in a woman under age 50, mammograms miss cancers about 40% of the time. And in women over age 50, they miss cancers about 20. I've heard 80 to 85%, so let's say 15 to 20% of the time. And the reason for that is dense tissue. Younger women tend to have denser breast tissue, which is why mammograms aren't recommended for younger women in the first place, because they're not particularly useful in finding breast cancers. As you get older, they are better at finding breast cancers because a lot of times when people go through hormonal changes, the density in the breasts diminishes. Thermography, on the other hand, averages a 90% sensitivity across all age groups. And so it's very interesting that it captures 90% of cancers, but it's true, and you should note that and be aware of that it does still miss 10% of breast cancers. So it's not the silver bullet be all and end all. The best thing you can do is combine your approaches. And if you combine approaches, we call that a multimodal approach here under the fast facts. Clinical exam, thermography, and mammograms average a 95% sensitivity of early stage breast cancers in all age groups. And so this combination of tools is better than any of the modalities used exclusively. They both find different things. For example, a mammogram can find calcifications. Thermography doesn't find that. Calcifications can become cancerous, but don't need to become cancerous. They don't necessarily become cancers. I use thermography to monitor people who have had calcifications found through mammograms. And what we monitor is there is no vascular change, because if there is no vascular change, nothing is developing or growing. But it's good together as an adjunctive tool when needed. Often a mammogram is considered an escalation, and you need to use it. Sometimes at some point, the benefits of a mammogram outweigh its risks. And that's really what you need to be aware of. When do the benefits outweigh the risks? We tend not to talk about the risks of mammograms, only saying how wonderful they are. And they do have some inherent risks. So, and I think it's only fair, I don't know if my time was enough to discuss these things, but let's assume it is. So I think it's only fair to talk about what thermography can and cannot do, because there's certain things it doesn't do. It can miss a breast cancer if it's very slow growing and has a smaller non-existent heat signature. And that's a DCIS situation, ductal carcinoma in situ, or women who have, often it's older women who develop these breast cancers because they've developed over many, many years. And again, you don't see them through thermography easily because they're such slow growing cancers. They may best be found through physical exam and then follow up. Also, you may miss a cancer when the heat distribution between the skin and the tumor is challenged, such as when tumors are deep within breast, like closer to the rib cage. Mammograms have a hard time there too. It's not a diagnostic exam. Mammograms don't diagnose cancer. They find heat, and a biopsy diagnoses anything. And they're not a replacement exam, but it's very good to balance the two, and you'll have more information to go on that way. However, thermography is excellent at finding inflammatory breast cancer. And personally, I have had cases where thermography has found inflammatory breast cancer, and there is no lump with inflammatory breast cancer, and it develops quite quickly. So this is a very good tool for that. And then another area that is interesting with thermograms and thermography is its greatest advantage, early detection, is its greatest weakness. And that's that whole area of like, perhaps something starts showing up on your thermogram at the early time frame, like at 2 years. And perhaps you rush and get a mammogram, and the mammogram comes back negative. So people have a tendency to say, oh, well, mammogram is negative. Like, what is it? Thermography is not really what it's cracked up to be. There's a false positive, false negative, whatever the term is used. And those terms, false positive, false negative, are really radiology mammography terms, because we're not looking for positive things and negative things, because I'm not looking for cancer. We're really looking at a continuum, and where are we going from lowest risk to highest risk. So we're tracking those things. And it's very important that if you have a higher thermography reading, it's a very early indicator that there's a problem. And we do actually have longitudinal studies, but you need to really look at over time when people have had high risk thermography findings. Invariably, if left, they develop into breast cancers. And you will see that if you look at longitudinal studies, say done over a 10-year period. So it's very important to be proactive and not dismiss high-risk thermography results. And I'm starting to wrap up now. So the benefits of breast thermography, we've touched on some of them. They can identify heat associated with a malignancy from the first stages of angiogenesis or new blood vessel growth to give you an early warning. It's very good to use on younger women, and it's very nice for younger women who have a history of breast cancer in the family. It's very nice to get a baseline, and you can track your health as you go from there. We touched on the fact that thermography can differentiate between cysts and cancer cells. Cysts don't create heat. They have a pattern, but they don't create heat. So they're easier. And so fibrocysts, the same thing. Those aren't high risk for breast cancer. As a non-contact procedure, it's a good test for women with breast augmentation or implants. It can be used to further clarify equivocal mammograms or ultrasounds, and I get people often coming to my office after having an equivocal mammogram or ultrasound to see, so what else can you find out for me? And it's 100% innocuous, no pain, no squishing, no contact, no radiation. It's very good. And what I'll leave you with tonight is what's stopping you. Preventing breast cancer is far more important and powerful than simply trying to detect it after it has already formed. And with that, I will turn this back over to Joe, and I don't know if there are any questions.
Thank you. That was fantastic. I don't know if we have any questions right at the moment. I think you did a fantastic job doing that. Let me get my video back on here.
Okay.
Here we go. So I am so thankful that you were able to join us tonight and do such a fantastic job sharing all of those things with us. We
Well,
did have some Facebook Live viewers, but they didn't give us any questions. So,
well, I hope I didn't speak too quickly for you. I usually can
no.
judge an audience by looking around the room, and I just have
Yep.
myself to look at here.
No, webinars are an art. It takes a little bit of time because you do feel like you're talking to yourself.
I
So,
do feel that way, and typically in a room, I invite dialogue and questions as we go along. So if anyone who is watching has a question, I'm more than happy to discuss any of that. And I do hope I didn't pack in too much information in a short amount of time.
no, I actually like it. I think everybody is time time
Crunched.
time crunched. That's the
Yeah.
one I'm looking for. That we end up very time crunched with our days, and to get like, get in, get out, get the information. And if they're like me, it takes time to process that.
True.
I'm thinking of it, and I'd like to always reserve my questions for a later date. So if you have an email that someone can email you at,
I
and I
do.
can post that.
Sure. And I was going to say, I also wanted to just talk a little bit about what you do, because so many times people can make preventive lifestyle choices and they may not know what to do. And so I think there are some general things we can say to everybody is like, up your vitamin D, get a little more exercise, eat lots of green leafy vegetables, drink water. But working with someone who's a health coach, because everybody is unique and different people may have sensitivities to one thing over another, it's very good to work with someone like Jody, who's a health coach and can help you navigate those waters. And so I just want to at least put that out there.
Thank you.
I think that's important. So my address is Pain-Free Imaging. Oh, there it is at the bottom of my slide.
Okay.
Oh, it's not there. It's my website is www.thermographyrochester.com. And my email address is painfreeimaging@gmail.com.
All right, great. Yeah, I find that there's a lot of different reasons why our hormones can be off, even with the hormone imbalance. And when you go into the doctor, a lot of time what they're testing for, I tell people when you look at that functional versus when I look at things functionally versus when the doctors look at things, 95% of people fall within the normal range. And it's just those outliers on each side that get diagnosed with something. And it's kind of the same thing when you compare the thermography and the mammography. Like you're narrowing the band, right? And so now I'm looking for an optimum functioning. I don't care if your vitamin D is within range.
Well, and that's the whole point is your vitamin D might be within range with everybody else who's your age living at this latitude, but that doesn't account for the fact that everybody living at this latitude is vitamin D deficient.
Correct. And what's good for one person,
isn't.
Your vitamin D is a pro-hormone. So when you say, to counter hormone imbalance, why do we need vitamin D? Well, it's a pro-hormone. Like vitamin D it's not just a vitamin. Vitamin D it's a hormone.
I haven't thought of it that way.
If you're hormone deficient because you're not getting enough vitamin D, you're missing a building block.
Yeah, I see your point. I never thought of it that way.
You can't build a house, right, without lumber. I mean, or without the windows or without parts. So when I look at people, it's very simple things. It's diet, it's lifestyle, it's what are you doing that's good? Let's maximize that. What are you doing that's bad? Let's take that out, and let's make this a priority. Because when they have this procedure done, and all of a sudden it's like, whoa, what do you mean that one's a 90? Like, wait a minute, right? Like, but what do we do now? Well, we're going to maximize, minimize, and prioritize, and that's different for everyone.
Yeah.
And that's what I do is I lock arms with people and, we really sit down, and because that can be overwhelming.
It is overwhelming. And I think there are a lot of things that we overlook, like what effects stress has on us.
Right.
And as far as like hormones, and I know from speaking with people that all teachers have adrenal fatigue. It's just the nature of it.
It's just the thing. It's the job.
So you can sort of guess that. Well, I mean, perhaps you can go and get tested and know that for sure, but that there's some sort of generalizations that one can make.
Right.
All teachers don't drink enough water. I'm coming from a teaching background myself.
Right.
I can't drink 10 glasses of water a day and be in a classroom because I can't leave every 15 minutes. And so,
Right.
you sort of, how do I get around that? And what is normal?
Right. Right. Yeah. I tell people, like, there's no normal. Most of us, it's a continuum. There's really no normal. But yeah, we're not designed to be toxic and stressed and inflamed and malnourished and unrested, and find a way to thrive, grow, reproduce, be thin, and have great sex. But all the time, it doesn't happen. If you're being chased by a bear, right? If your body thinks you're being chased by a bear,
the last thought on your mind is having a romantic evening.
Like, what are you gonna do? I mean, and we live in a world where we stress ourselves out over so many things, and we're not going to change that necessarily. Like, teachers are still going to be in the same situation. So what can we do to mitigate that stress?
Exactly.
And
exactly.
reframe it, and do other things to support ourselves. And that's why I said, like, everybody's different.
Mm-hmm.
So
I just want to thank you for giving me this opportunity, because I love talking about thermography, and I think it's just a really valuable tool to see what's going on. Because I think our body gives us signs of when it's in stress or distress.
Mm-hmm.
We just don't necessarily have the eyes to see it. And this is just a nice way to enable that.
Yeah, it becomes your new normal.
Mm-hmm.
It becomes your new normal, and you don't realize it until things are different. And then
you look back on it and you'll sort of like, oh my gosh, I did those.
Exactly.
Yeah.
Exactly. All right. Well, since we didn't have any questions, I'm going to stop the recording.
And thank you once again.
Yep. Thank you.